Welcome back to MSNBC Live. I'm Carlos Watson. Now, as President Obama prepares to push his health care proposal to the American people tonight, Republican members of Congress say the president is moving too fast. Joining us now from Washington is Republican Congressman Jack Kingston from Georgia. He sits on the Appropriations Committee. Congressman Kingston, good to see you again, sir.
Well, it's good to be with you, Carlos.
Congressman Kingston, so what did you make of your colleague over in the Senate, Senator Jim DeMint, saying that he hoped to stop Obama on the health care legislation because, in fact, it would break him and turn back his agenda? Was that constructive language? Is that what we should hope to hear from our public servants?
Well, I think that the president would like to frame it as being a non-constructive language, but I think the way Senator DeMint came back yesterday and said, you know, the president keeps saying doing nothing is not an option, and we are not doing nothing. We've offered association health care plans. We've offered a tax voucher. These things have been introduced as early as in May, and the Democrats have said no to them. And what Senator DeMint did on the Senate floor was list about 5 or 6 solid Republican proposals and said, we want to work with the White House. So I think that if DeMint had kind of cowered and run under a rock somewhere and said, whoops, it would have been bad. But I think he came back strong, and the president inadvertently has elevated Jim DeMint now to a national level where he can be a player in the debate.
Congressman Kingston, which of those ideas that either you've outlined or that Senator DeMint has outlined do you think will ultimately make its way into legislation that gets passed and signed?
Well, we hope that this tax voucher plan that would give every American a tax voucher to go out on the private sector and buy insurance so that we could deal with the 47 million who are uninsured. We think that's a more effective way to deal with this situation, and it's less expensive. It doesn't set up government-sponsored health care or a government option which competes against the private sector. So I hope that that makes it, at least in part, and I do think that it's important to listen to what Jim DeMint said, is we do want to be part of this, and we have offered alternatives, and right now they're less expensive and potentially cover more people. Keep in mind that for a $1 trillion price tag, the president still leaves 20 million Americans uninsured.
Congressman Kingston, I'm joined this morning by my guest co-host Richard Wolff.
Congressman, we were just talking to Senator Gregg, who's a big advocate of having one of these Medicare committees bring down the costs of Medicare. Is that something you'd agree with? You could work with the administration in coming to a fruition?
Richard, I think that it is. You know, I don't want to give an outside committee too much power, but I think that outside committees such as the one for base realignment and closure, BRAC, I think they can be very effective. As you know, Medicare has a huge unfunded liability, maybe as much as $60 trillion, and we're afraid politically to touch it, because anytime you try to rein in the cost, you're cutting health care for senior citizens, and it's a very powerful political group. So I think that if we could make this genuinely bipartisan and seize the moment as mature adults are able to do on occasions, even in Washington, I think it would be a great step.
Well, I mean, Congressman, just to follow up on that, if the administration says, yeah, we'll do that, we'll work with you to bring down those costs, would you be prepared to sign up to something that Democrats want to see, such as a health insurance exchange or a government option?
Well, I hope it's not a swap, because I would think saving Medicare would be bipartisan and something that is not a bargaining chip to get us on board government options. You know, if there's some reasonable argument that, okay, if you reform Medicare, therefore you need to do the following, I think we should also be able to come together on that. But I would not say let's trade one for the other, because Medicare has to be dealt with, because there's too much of an unfunded liability that baby boomers are facing as they go into their retirement years.
Congressman Kingston, thank you so much for joining us this morning, sir.
Thank you.
For more on the